Joining me now for more information on the subject is Dr. Karpati, Senior Vice President of Public Health Programs at Vital Strategies, an organization dedicated to strengthening health systems for progress in lung health, non-communicable diseases, and more. Dr. Karpati, welcome to the show.
Thank you very much.
Let me have your reaction to the report, WHO's report. What really troubling, I find, is the fact that traffic accidents is the #1 killer among the youth.
Absolutely. What's most important, I think, here is that this report highlights how big a problem deaths on the roads really are. That figure of 1.25 million deaths a year, it's one of the leading causes of death in the world. And as you say, it's the leading cause of death for young people. What's encouraging about this, of course, is that deaths on the roads are preventable. So these tragedies can be prevented, and we know what to do. And the challenge is implementing the proven strategies for getting those numbers down.
So what is blocking the implementation of some of these strategies? We see countries like the UK and the Netherlands doing well as opposed to other countries. So what is the issue? Is it resources?
Resources is certainly part of it, but really it starts with political will.
Okay.
It starts with the will and the desire of governments to have an impact on this leading killer. And then the next important aspect is the need to do a comprehensive approach.
Okay.
It is not sufficient to do any one thing, but to really do a series of things. For example, we're talking about speeding. Laws need to be in place in order to control speed limits. Those laws need to be enforced. Yes. So that has to do with law enforcement, police practices. There needs to be public awareness of the dangers of speed and the importance of staying within speed limits. That's public education. Data needs to be collected about where the problems are around a country or in a city in order to target resources as needed. And we need to design roads better to protect pedestrians and to lower the speeds of cars. So you really need a comprehensive approach. It takes multiple sectors within
yes.
government to do that, and it requires political leadership to hold it all together.
So how is Vital Strategies contributing to helping solve this issue?
So Vital Strategies is one of the organizations participating in the Bloomberg Philanthropies global initiative on road safety. Okay. This is an ambitious initiative sponsored by Bloomberg Philanthropies to address and reduce mortality, injuries on the roads in 10 cities around the world, 10 large cities around the world, in Latin America, in Asia, and in Africa. And also in a number of large countries around the world. And we are working with technical partners around those issues I said before, yeah. Issues of road design, of policing, of data collection, and of public education and mass media, to implement and work with governments to assist them okay. in doing executing the work okay. on the priorities that they've established.
And before we wrap, you're working in Africa and a few countries.
Yes.
Very quickly, what are some of the positive outcomes you've seen in your work and in one or two countries?
You know, we're working in, for example, in Addis Ababa, okay. And there the mayor and the government agencies are highly committed to road safety. They've instituted a number of really innovative solutions around designing roads, redesigning intersections, protecting pedestrians, promoting walking and pedestrianization of the city, increasing law enforcement, mass media campaigns, okay. And really a comprehensive approach. And that's an example of some great work going on in Africa.
That's fantastic. Dr. Karpati, thank you so much for joining us today.
Thank you very much.
And that was Dr. Karpati, is Senior Vice President of Public Health Programs at Vital Strategies.